Greetings to the judges and watchers. Students name Ansh Singh, Lakshay Goyal, Priyanshu Kumar Pandey. Project Covet 2.0. Mentor name Mrs. Sakshi Dixit, TGT Computer Science. Mrs. Neha Gupta, TGT Science. Sub-theme is disaster management.
The name of our project is Cov-Aid 2.0. Index. Information about our project, problem analysis, features of our project, working of our project, benefits of our project, and softwares and technologies used.
Information about our project. Last year during the first wave of coronavirus, we made an app COVID to help people during the start of the pandemic. All the features were according to the first variant of virus which was not that fatal to help people get virtual care and ease during that time. We were very satisfied to see its positive response and its basic purpose was to help you relax people mentally, give you some information about the disease as it was the start of the spread, make you fit to handle it, and help you at the time of minor emergencies. But then we observed that the new wave that came in 2021 was heart wrenching. We lost our loved ones, and the wave is hitting us hard. We were very depressed to see people passing away just because they didn't have COVID resources like oxygen cylinder, beds, plasma, medicines, etc. We decided to bring the 2.0 update of COVID and include features which could really help them fight the deadly second wave of the virus. We combined the previous helpful features with the new features that could help people to cope with the second wave. Problems in the second wave of COVID. People don't have enough COVID resources due to high demand and lack of availability. Spread is on spike. Cases are increasing at a high rate as compared to the first wave. As the spread is high, so the testing is also increasing and people need information about testing centers. People need some common information related to the second wave like documents required at the vaccination center, work from home tips, RT-PCR test tip, etc. People needed to track all the cases recovery and all details about the cases of different countries, all continents, all Indian state and union territories. People didn't know about vaccines and vaccination centers. They needed to know all about immunization.
Features of our project. The features of COVID 1.0, which was the older version of our app, is first, coronavirus probability test. Second, donate or retrieve food. Third, corona games. Fourth, respiration exercise. Fifth, web page. Sixth, emergency helpline call button. Seventh, no face sensing. Eighth, medicine reminder. Now the newer version of our app is Cov-Aid 2.0. So the features included are first Cov-Aid, which includes all COVID resources. Second, tips, which includes all information regarding to second wave. Third, centers, which includes all information about testing and vaccination centers. Fourth, COVID tracker, which includes all details about cases. Fifth, information, which includes all details about COVID. Sixth, automatic Google sign-in. Seventh, all data is real-time updated. Eight, COVID portal direct access in our app. So we have merged our app COVID 1.0 and COVID 2.0 to make our new app COVID 2.0, which includes these all features.
So this is our app. When you open the app, you will get a loading screen. It will take a bit of time to load, and after loading you will be transferred to the home screen. So basically this is the home screen for COVID 2.0. You get four features here. The first one is COVID, then tips, then centers, and then COVID tracker. You get some useful information here, and then at the bottom of the home page it is the COVID 1.0. When you click on this, you will be transferred to the first version of COVID. You can also give the feedback if you want, like you can type your name, your email, your suggestions, and give the rating so that we can see did you like our app or not. So let's go to the first feature, that is COVID. So the purpose of this feature is to give the crowdsourced resources, COVID resources to the people, and this is sorted lists of them. These are the real-time updated statistics. If you click on oxygen, it will take a bit of time to load. So these are the oxygen suppliers for the pan India. You can also search for a simple a particular oxygen supplier like this, and you can like take the details as well, like the complete details. So the name, contact, state, location, status, updated on cylinder, cans, refill, and some other informations. So similarly, it is for plasma as well. You can see that. And when you go here, you can see the detailed information about them. And similarly for beds, if you go on this, you get all the details about the bed. So this is like the crowdsourced resources. They are like around in 1000 to 2000 resources, and they are updated regularly. The best part is this. These are ambulances and the medicines. You can take the detailed report from here, like which type of medicine, state, contact. For food, with detailed information. Then doctor, and then home nurse, and then for home ICU, mental health resources, and also for the social groups like the Telegram, Instagram, and Facebook groups of different state related to COVID-19. You can join them. The next feature is tips. So if you click on this, these are some handmade tips by our team. So you can see like these tips are related to the second wave of coronavirus, and the tips are also like work from home tips, RT-PCR test resources, documents needed for COVID-19 vaccine, and like this. You also get some informative YouTube videos. The next feature is centers. So you can for like if for the people who want to know about vaccination centers, they can use this feature. And you can also search like a particular hospital. So when you click on this, you'll get the state, like which state, and you can also get the full list in the form of Excel. And similarly for testing centers, and then the full list. The next feature is Covet Tracker. So using this feature, you can track the COVID cases of different countries, continents, each Indian state. So if I click on India, and then so these are the information: cases, deaths, recovered, tests. If you click on cases, you will get all the detail about cases. If you click on deaths, you will get all the detail about deaths. And these statistics are real time updated. If you click on view India, you will get all the Indian states. For example, if I take Delhi, then I can click on this button and see the active confirmed cases, deaths confirmed new, deaths new, and the last updated is like today. So these are updated regularly. The next feature is information. So you can view this information in English and Hindi both. And using this, you can like directly access the COVID portal using our app and book your vaccination slots. And the state-wise helpline number of each state. And when you click on COVID 1.0 button, you will be transferred to COVID 1.0. I'll not give the detailed explanation of each features as we have already covered this in last science exhibition. You can view that video. So this is coronavirus probability test. You can test like whether or not you are suffering or you may have the chance of coronavirus. Donate or retrieve food. By this, the people can like donate the food, and the needy people can like take it from their address. So yeah, the people can give their necessary details. The corona games, the respiration exercise, and the web page, then the emergency helpline call button, then no face touch sensing. This is artificial intelligence enabled no face touch sensing. So if by mistake you touch your face, it will alert you. Then medicine reminder. You can set the reminder for future medicine and keep the notes of last medicine you took. And so that was our project Covet. Thank you for watching.
Benefits of our project. People get sorted lists of all COVID resources, using which people can get all the details about the resources like oxygen beds, etc., with their phone numbers, availability status, and other important information. People get tips related to the second wave of virus. They can look for common informations like what document to carry at the vaccination center. People can look for vaccination and RT-PCR testing centers state-wise. Even small towns and villages are included in the data. People can get the data about the cases details of for every country, continent, and whole world, and even each Indian state. The best part is that data is up to date as it's fetched from an API. People can get all government related COVID information like state-wise helplines, important links. You can view all this information in Hindi and English both. Can access COVID portal directly through the app and can book vaccine slots. People can calculate their chances of coronavirus using coronavirus probability test. People can play corona games to relax themselves and to be mentally refreshed. People can practice robot-based breathing exercise where robot will be guiding you. People can get all details about COVID-19 through an interactive web page. People can use emergency COVID helpline call button at the time of emergency. People can use no face touch sensing feature so that when they touch their face by mistake, they are alerted by the app. People can use medicine reminder to set reminders for future medicines and to keep the note of past medicines.
Platforms and technologies used: Visual Studio Code, Android Studio, Flutter, Kotlin, Firebase, Python, TensorFlow, Pandas, NumPy, Flask, ML5.js, P5.js libraries, Canva, Filmora X. Thank you. We hope this app can bring a change in the society. If you also feel so, please do support us by liking, sharing, and commenting. Thank you.